Good afternoon, everyone. My name is Professor Thomas Chordosh, Director of the Global Health Program. I welcome you all to the 2025 Horizons of Global Health Research Symposium. This marks our 12th annual symposium, and we're proud to see our event continue to thrive and be what it has become today. Today's gathering not only brings together our global health community, but also allows us to honor our students and celebrate the extraordinary work happening on our campus and beyond. Before we begin, I'd like to highlight some upcoming Global Health Program events and application deadlines. If you're a rising senior interested in participating in next year's Horizons, please apply to the Honors Thesis Program. The 2025-26 Honors Thesis Cohort application is now open. The applications close on June 15th, and students will be notified over the summer or early fall. The application link is on our website and in recent GHP newsletters. Next Friday, May 23rd, Global Health Program alum Celia Brewer is offering a Zoom workshop on working in international aid. Celia is the head of partnerships at the Trust for Indigenous Culture and Health, a Kenyan organization that works through culture to improve community health and well-being. On Tuesday, May 27th, Students for Global Health have their end of the year celebration at 6 o'clock in the Public Engagement Building, PEB 425. Which is our global health classroom space. And if you're interested in joining Students for Global Health, you're welcome to come to that event. Please see the latest Global Health newsletter for more information about these events. I'd like also to extend a heartfelt thank you to our Global Health Program student representatives for this past academic year, Suhana, Nea, Diane, Kylie, and April, for their hard work in organizing events, planning programs, and representing us at campus events. Your leadership and dedication make a significant impact on our community, and we're grateful for the work you do. And finally, for those in global health courses receiving extra credit for attending today, online sign-up sheets will be posted toward the end of the event. Many, many thanks to the co-sponsors of this event. Our sincere thanks go to our sponsors, co-sponsors, and supporters, the School of Social Sciences, Students for Global Health Organization, the Center for Global Mental Health, and the Global Health Program. We also appreciate the contributions of our global health student leaders in Students for Global Health, whose efforts throughout the last academic year have enriched our community. A special thank you goes out to our undergraduate advisor, Jane Eichhorst, and our graduate advisor, Brittany Wright, whose efforts helped make today's event a success, and to whom I am grateful on a galaxy-wide scale for their work and contributions in supporting our students. Thank you as well to the tabling organizations, the outstanding organizations who have participated in our Field Experience Tabling Expo today. The Expo is a part of Horizons that kind of got a little bit attenuated in the moment of the pandemic and post-pandemic, and I'm really pleased to say that we are back up to speed, and we're grateful to the people who have participated and the organizations that have participated in our Field Experience Expo. Child and Family Health International, the Center for Student Involvement, the Alternative Breaks Program, Study Abroad, Volunteers Around the World, the Global Health Alliance, and the Students for Global Health. Please join me in giving a round of applause to the organizations that provide valuable opportunities for student involvement experience in global health. Now we would like to announce the winners of the Global Health Field Experience Scholarship. When we call your name, please stand up and stay standing until all names are called. From those who are participating in volunteers around the world, in Guatemala, Alexandra Andrade, Prisha Desai, Tara Gagar, Ashley Levia. From the UC Davis Study Abroad CFHI program in the Philippines, Zarina Datils. From Safari Doctors in Kenya, Heloise Frankston. From the UC San Diego Study Abroad Global Seminar, Health, Healing, and Sustainable Community Development in Bali, Lucille Manzo. And from Global Health Leaders in Dominican Republic, Emma Gelmeland. From UC Alternative Breaks, the Bali Institute, Phoebe Arthur, Samantha Scroggie, Caitlin Shiroishi, and Rosalind Simca. Congratulations to you all, and we look forward to hearing about your journeys abroad. Our advisors will be reaching out to you with additional details. And if you want to follow up with all these students, when our students abroad who are supported by this scholarship return, one of the things that we require of them is a blog post to describe in a paragraph what their experience was. So keep your eyes tuned as time goes by to our program blog. Congratulations now to the 2025 Horizons Research Symposium participants. These are people who participated with posters. We're immensely proud of all of our students who developed research topics and presented their posters showcasing the diverse global health efforts taking place on campus locally and internationally. This includes 10 global health MA students, 14 global health honors thesis students, and 13 additional contributors from outside the program who we welcomed joyfully into our ranks of presenters. The outside students who submitted abstracts and participated in the poster session, we congratulate these students on their research accomplishments. When your name is called, please come to the stage to receive your certificate. Marianne Aquino, Lauren Bohal and Gali Lalu, Lucia Sichowski-Rezek, and Kendra Sanchez, Niall Connolly, Esther Na and Rocio Silenciario, Skylar Fesagaiga, Diane Murphy, Lisa Neumeister, Caleb Sarang, and Lauren Whiteman. So all of you, welcome to the Global Health Program. Now we'd like to recognize, these are the folks that I just mentioned. You can see what their names, and you can, in some cases, you can probably pronounce them better than I have done so. Now I'd like to recognize our Global Health Master's students, MA students who participated. We're incredibly proud of your achievements and the fascinating research efforts you've undertaken over the past year. Your work has been an inspiration, and we know you are headed for great things. These are, and we invite you to the stage when your name is called to receive your certificate, Amoha Bale, Liana Cortez, Samantha Davis, Brian Gorman, Kristen Lips, Ashlain Malik, Jimena Norom, Gain Ortega, Dania Taki, and Ashley Valencia. Congratulations to all of our 2025 graduate students in the MA in Global Health. Now we have our honors thesis, our undergraduate global health majors, our honors thesis. Oh yeah, we should, yes. Yeah, it is. You all can go take a seat again, and we'll have it so that we're not really worried that the stage is going to break down, but you can never tell. Play it safe. Our honors thesis students, these are undergraduate BA and BS students who are in the honors program and who have now participated also in the poster presentation. The honors thesis is a 2-quarter-long program that gives students the opportunity to expand on their global health field experience or dive deep into a topic of personal interest, culminating in a senior thesis project and poster. This intensive program, featuring in-depth discussions and research, equips our students with significant credentials for their future careers. I would like to have a special acknowledgement of the instructor for this group, Dr. Bonnie Kaiser. She has been an instrumental and important part of the Global Health Program in general, and a phenomenal honors seminar instructor. And I will also mention that she teaches in the graduate program as well, our methods course, research methods course for the master's students. And Bonnie, if you're here and you're able to stand, there's Bonnie over by the window. Thank you. Good luck on Tuesday. So we have, as I read your name, please come to the stage to receive your honors cord and certificate. We have, let's see, there they are, okay. I'll let you hand out the cords, okay? Well, I call the names. So we have Hannah Akob, Jeffrey Chapman, Andrew Frank, Kushi Kumra, Xuan Li, Nicholas Navarro, Julie Nguyen, Priya Roy, Lauren Sheila, Samantha Scroggy, Suhan Singh, Simran Subramaniam, Angelique Tran, and Angelina Zhu. Now, these honor students, we're presenting them with not only a certificate, but we're also presenting them with a cord that signifies specifically the Global Health Program and their participation in it, so that they can wear it as part of their regalia when they walk in the graduation ceremony that's upcoming. We're very proud of all of you. Don't go anywhere so we can take a photograph of you. Do we have a? Okay, great, perfect. I'll sneak into this photo as well. Wait, you know what? Bonnie, can you come up for a photo? Bonnie is about to have a new addition to her family very, very soon. All right, now the moment we've all been waiting for. I'm very honored to introduce this year's keynote speaker, Carrie Hessler-Radelet. She is the president and CEO of Global Communities, an international nonprofit dedicated to advancing equity, saving lives, and building strong futures through global and local collaboration. Prior to this role, she led Project Concern International, which merged with Global Communities, and she's held leadership roles as well at John Snow Incorporated. She has on-the-ground global health experience in countries including the Gambia, Indonesia, and Palestine, and policy experience at the highest levels. This experience, now get this, spans an early period as a Peace Corps volunteer in Samoa, all the way to a term as the director of the Peace Corps under President Obama, where she spearheaded major reforms. That's like a lifetime of commitment to the Peace Corps. In between those Peace Corps experiences, she was lead consultant in launching the PEPFAR program on AIDS under President Bush, and worked with USAID in Indonesia on maternal and child health and HIV programming. Carrie is passionate about empowering communities to create sustainable change. Her keynote talk for today is Rooted in Resolve, Hope and Leadership Amid Global Health Challenges. Please join me in welcoming Carrie Hessler-Radelet.
Good afternoon, everyone. Good afternoon, everyone. Okay, I'm going to demand a little audience participation here. I'm just going to warn you in advance. It is such a joy, I have to say, to be here at the Horizons of Global Health Research Symposium. I want to start by thanking Dr. Tom Chordash and the faculty and staff at UCSD for inviting me to speak to you today. I'm so excited to do that. I also, just on a personal level as a public health professional, I'm so very grateful for all you do to train this extraordinary, diverse, and talented group of students for careers in public health and global health. So I just want to thank you for that. I arrived early. Some of you may have seen me eating pizza and visiting some of your poster sessions. All I can say is, wow. Now, I've been around a while. You see my bio. It's been a long time that I've been in this business, and I can tell you with full honesty that the quality of the posters, the professionalism that I witnessed, and your presentations was really top-notch. It just was so inspiring to see your enthusiasm, your passion, the importance of the topics that you addressed, and just your command of the content. So thank you for teaching me actually quite a lot. I learned a lot from you, and I'm so grateful for that opportunity. What a privilege it is to be with you at this defining moment in time, not just in your academic journey, but in our shared pursuit of a more just, equitable, and thriving world. In your commitment to global health, I see powerful evidence that the world we hope for is not only worth fighting for, but is also still within reach. So now, before I get started, I'd really like to get a sense of the room because I like to know who I'm talking about. So this is where I'm going to demand a little audience participation. So, stand up if you are an undergraduate student. Good job, look at this. Stand up if you're a grad student. No, you get to stay up. Stay up. My goal is to get everyone standing, right? Stand up if you're a grad student. How about If you are a first-gen college attender, raise your hand so we can honor you, seriously. I guess I'll let you put your hand down. It's a little awkward. How about if you're a family member or supporter of a current student? Are there any family members here? Good, I see a couple family members. Stand up. How about volunteer or staff of a participating NGO, including my own, Global Communities? Please stand up. How about faculty and staff? So who am I missing? All right, excellent. How about one more who stood up and I missed in the blue t-shirt? No? Okay. Excellent. Well, I am so grateful to all of you for being here. It means so much, and I'm inspired by all of you, honestly. You may sit down now. So I guess I speak for myself, but I think I speak for a lot of us, that the past few months have been heart-wrenching and incredibly difficult in the global health space. Our country's unprecedented shift away from meeting the needs of the most vulnerable on our shores and across the globe has created an extreme sense of disruption, chaos, isolation, and loss. That's what I'm observing. But while the uncertainty is real and much of it is beyond our control, I'm here to remind you that we are not powerless at all, and we are certainly not without purpose. The need for our work has not disappeared or lost value, even if the landscape around us has changed dramatically. Indeed, the challenges we face today are complex, diverse, interconnected, and daunting, actually. But they are not unsolvable. They are not unsolvable. What they require from us is not perfection, but persistence. Not isolation, but collaboration. Not cynicism, but creativity. We have an urgent need and opportunity to adapt our thinking, to capitalize on our academic training, to test new ideas, and to meet this moment with humanity and humility. We can build upon our own lived experience and our work, our volunteer experiences that will enable us to shape the context as we understand it and give meaning to our work. So I want to start by sharing the story of one of your fellow students who just received an award. Simran Subramanian is right here. So happy to meet you. I interviewed Simran, so I'm going to just tell a little bit about her story because her story inspires me. And to me, it illustrates the importance of building upon our lived experience as a foundation for discovering our life's purpose. So Simran's journey to UCSD's Global Health Program and her aspiration to pursue a career in medicine were profoundly influenced by a deeply personal experience that she was willing to share with me. When Simran was a young girl, her beloved grandmother was diagnosed with Alzheimer's disease. This diagnosis was particularly challenging given the lack of awareness and understanding of the condition at the time and the lack of dementia tests and tools for more diverse populations. Simran said she witnessed firsthand the immense heartache her parents experienced navigating what she aptly described as the caregiving roller coaster. The struggle to access resources and the lack of understanding about her grandmother's condition are what ignited Simran's search for answers in her academic life. Here at UCSD, Simran says she embraced the opportunity to explore health from a more holistic perspective. She has delved into health policy, worked at the school's food pantry, organized initiatives with the Students for Global Health. You saw there were lots of opportunities to do that. These experiences have given her a deeper understanding of the myriad factors that shape a person's health and quality of life. In a nod to both her grandmother and her grandfather, who was recently diagnosed with dementia, Simran focused her thesis on integrated care for dementia in culturally and linguistically diverse communities. After graduation, she hopes to attend medical school and continue her work in this vital area of study. I share Simran's story with you because, like her, we all have unique personal stories that guide us towards who we become professionally. These stories are a tapestry woven from our backgrounds, our experiences, our challenges, and our triumphs. They are not just narratives of our past. They are integral to our interpretation of the context of the world and central to shaping our values and our motivations and our perspectives. In my mind, our lived experiences are our greatest asset. So embrace your lived experience. Whatever brought you here to UCSD, the skills you have learned here are the tools that will enable you to navigate the complexities of global health. They include technical expertise, critical thinking, and evidence-based practices that are essential for the provision of care. However, it is your passions and your lived experiences that breathe life into these skills, transforming them into something more profound and more meaningful and more uniquely you. Your lived experience will bring a level of authenticity and empathy to your work that cannot be taught in a classroom. And they will help you to connect with people and communities on a much deeper level, understanding their needs and challenges in a way that goes beyond clinical knowledge and builds trust. Knowing your why and staying true to your own internal compass will fuel you on your most difficult days and will never steer you wrong. The UCSD Global Health Program, to which you all belong, is driven by a vision that health is a human right, not a privilege, and that where a person is born should never determine whether they have access to the care, safety, and opportunity they deserve. That vision and your presence here today is what gives me hope for the future. It reminds me of why I chose this field more than 40 years ago and why I've stayed with it ever since. So I'd like to share with you a little bit about my background, my story, my life experience. Like many of you, I didn't arrive in this field by accident. I was shaped by personal experiences, driven by questions I couldn't ignore, and inspired by the power of connection across cultures and borders. Before I was president and CEO of Global Communities, before I was director of the Peace Corps, before I had a 25-year career in public health, I was a student searching for meaning, trying to understand my place in the world and how I could make a difference. I definitely didn't have all the answers, and I didn't know what I wanted to do with my life, in all honesty. But I knew I didn't want to be a secretary, a teacher, or a nurse, which were the three options that my high school guidance counselor suggested to me. Now, I am older than most of your parents, so there weren't as many options for women in those days. But I was determined to see the world, and I knew I wanted to do something to make it a better place. I just didn't know what. I was a decent student, but not an outstanding one in the beginning. I spent the first year and a half at a local college to save money, and then I transferred to Boston University. Boston University is sort of like my UCSD. I grew up in northern Wisconsin in a middle-class town where just about everyone looked just like me. And I loved my hometown, and I really did. But I decided to go to an out-of-state university, in part because I knew there was a great big world out there, and I had a lot to learn. I just didn't know what. And what I found in university was one of the most diverse and globally connected communities that I could have ever imagined, but I have to say it does not hold a candle to this place. I am blown away by the diversity of all kinds here in this room. It is incredibly inspiring. I did not have that kind of experience, but it definitely opened my eyes anyway in an urban campus in Boston. It was a place that not only encouraged me, but challenged me to step out of my comfort zone, to grow intellectually, and see the world and my responsibility within it in a new way. During undergrad, I took classes on comparative religion, politics, international relations. I studied Chinese language, and I focused on African history. But my passion for global health really began when my husband and I joined the Peace Corps and served in Samoa, a small village called Leulumoenga. This is not a test, but I would like to know how many of you have heard about Peace Corps. Oh, I'm so happy. That's great. Any of you interested in working overseas? All right, that's great. Well, I want to tell you that Peace Corps is one of the best options, especially right now. You want to get out of the country? Peace Corps is a great option. So come and find me afterwards if you're interested. And there are a couple, maybe if you're a return Peace Corps volunteer, I know there are at least 2 return Peace Corps volunteers. Stand up if you are one of them. Okay, I'm one of them. All right. So you can ask us about that. So let me get back to the story. So Steve and I lived in a small village of about 300 people. We taught at an all-girls Catholic school. We lived with a wonderful host family, Losa, her husband Vianney, and their 8 children. Losa was 32 when I arrived. I was 24. Her reproductive life had started early. She had her first child at age 14. She was a wonderful mother to her children, and we became very, very close. Losa was curious about my life in the United States and often asked about why I had been married for over a year and a half and didn't have children. At first, she thought there was something wrong with my husband, in all honesty. But that led to many conversations about family planning. She confided that her husband wouldn't allow her to use contraception. She loved her children, but she was exhausted, physically, emotionally, and economically, in all honesty, and she did not want any more babies. So one day, a couple months later, I came home from school and found Losa alone in her house, sobbing so deeply she could barely breathe. Now, I thought something had happened to her children or her husband, but the reason for her tears was that she had just discovered that she was pregnant again with her 9th child. She was devastated. She did not know how she would be able to carry that child and still be able to do all of the many, many responsibilities she had as a mother of 8. Her days started at 4 a.m. when she got up to cook food. She ironed the school uniforms for each and every one of her kids. They were spotless. I don't know how she did it. She then prepared their meals, sent them off to school, went to work in the field, sold the produce in the market, was there when her kids came home, prepared the evening meal, helped her kids with the homework, and put them to bed at night. And then she could fall into bed exhausted to get up again at 4 a.m. the next day. She did not know how she could carry another baby with so much on her plate already. Now, I knew nothing about pregnancy, but I knew that my mother, when she was pregnant, got prenatal care. So I asked her, "Where did you deliver your baby?" And she said that each and every one of her babies had been delivered on the floor of her home, attended by her mother-in-law, who seemed to be ancient, frankly. She's probably younger than me now. But she delivered each and every one of those babies on the floor of that home. She had no access to medical support, no access to emergency services, just faith, tradition, birth, and happily survival. Now, I remembered that when I first moved to that village, Peace Corps volunteers have to map the village, and I knew there was a clinic there, and I knew that clinic had a midwife. So I asked Losa, "Have you ever been to that clinic?" She said, "Yeah, I've taken my kids there to be immunized." I said, "Have you ever gone for care yourself?" "No, never," because Samoan women barely ever think about themselves. So I suggested that we could go together and meet the midwife, and she agreed to do that. When we arrived at the clinic, the midwife did a thorough examination, and this is what she said. She said, Losa, you are a very high-risk pregnancy. You've had 8 children in rapid succession, the youngest of whom is only 14 months old. You are seriously anemic, and your body is already under enormous stress and strain. You need to do 3 things to deliver your baby safely. You need to see me every month, you need to take prenatal vitamins, and you need to have your baby here in this hospital. You need a trained attendant, a trained provider at your birth. I could see Losa's face fall visibly. All health decisions in her family were made by her husband, Vianney. She knew that Vianney would actually accept her coming to the clinic once a month, and he would accept the prenatal vitamins as long as they were free, which they were, but he would never permit her to deliver her baby in the clinic. Samoan custom was that babies were born at home, where the first face they see is the face of their family, the people who love them most. And that makes a lot of sense, actually, I have to say. But this midwife was very wise. She started scheduling Losa for the last appointment of every day, or every time she went, she was the last appointment. And then the midwife would walk up to Losa's house with her, and she'd sit with the family. She stayed for tea, or she'd stay for dinner, and she just got to know the family. She didn't dominate the conversation with messages about health or birth or anything like that. She chatted with them about the things they wanted to talk about. They talked about life in the village. They talked about the kids' soccer scores. They talked about school and teachers. They talked about the weather. They talked about local gossip. But mostly, she listened. Over time, weeks, then months, the midwife earned the trust, first of Vianney's husband and eventually of her mother-in-law, Margarita. She spent a lot of time with Margarita, and she really learned to honor what Margarita knew about childbirth. She had a great deal of indigenous knowledge that impressed her. And then, once trust was established, the midwife gently began introducing conversations about safe delivery, nutrition, and postpartum care, and how vulnerable physically Losa really was in her pregnancy. In the end, over many stories and many hours of getting to know one another, Vianney did agree that Losa could deliver her baby in the health clinic, with her mother-in-law Margarita standing right beside the midwife to catch the baby. The first face that baby saw was the face of her grandmother. It's a good thing she did, because 5 minutes after baby Margarita, baby number 9 is called Margarita after her grandmother, Losa went into postpartum hemorrhage. She would have died if she had given birth on the floor of her home. But she lived because she was attended by a trained physician with good skills. She had medicine, and she had access to an ambulance. And now Losa has 15 children. That midwife changed the trajectory not only of Losa's life and her entire family's life, but my life. Although I didn't realize it, in all honesty, until more than a decade later. Watching her work became the inspiration of my own career in global health. She taught me that technical expertise matters, but trust is what makes it all work. She taught me that solutions must be locally led and community grounded, that development is not something we deliver, but rather something we build together. You know, I have to say, a confession, I'm very embarrassed because I don't know the name of that midwife, but she has been a pivotal character in my own career development for a long, long time. I just didn't realize it at the time. I wish I could go back and thank her. So let me say it now to all of you. If there are people here in this program or anywhere else that have changed your life for the better, thank them. You will regret it if you don't. I know I regret that. And you know what? It's so important for people to know if they made a difference, because they're working hard to help others. So tell people if they have made a difference in your life. That first career experience shaped more than my understanding of global health. It shaped my worldview. It taught me that real change begins in a classroom, sometimes where we learn, but it comes to life through our lived experience. It starts with listening and walking alongside people, not ahead of them. And the kind of work demands more than technical skills. It requires commitment, curiosity, a willingness to learn, and a commitment to staying. Global health, like all work rooted in equity, service, and justice, is about playing the long game. It demands hard work of all of us. It demands persistence. It demands humility. It requires us to stay the course even when the outcomes are uncertain, even when setbacks occur, and even when systems within which we work feel so resistant to change. The goal of global health isn't just to treat symptoms, it's to confront the root causes of health disparities between nations or populations. It's about asking hard questions, practicing radical collaboration, adjusting our approaches, and working alongside communities across the globe to co-create solutions that have a lasting impact. You are beginning your professional career at one of the most important times in human history. And this program, this community that you've developed here, has given you the knowledge, the skills, the tools that are needed to embrace the cause of humanity at a time when fresh perspectives and new ways of approaching work are so desperately needed. Do not let indifference or bitterness or frustration or cynicism cause you to abandon the cause of global health. Instead, be transformed by the knowledge that you are needed. UCSD's Global Health Program embeds global citizenry into your DNA, where compassion for one another and caring for the world we share are part of what it means to be a student here. Choose the kind of defiant optimism that sees the world as it is, with all its pain and with all its perils, but also all its progress and its potential, and believe what it can become with your contribution. That belief has guided me throughout my long career, especially when there was no clear path forward. I didn't come into this work thinking that one day I'd be a global leader. There was no huge grand plan for me, in all honesty, just a series of moments when I had to choose courage over comfort. Many of you know that I am the president and CEO of Global Communities. And I found my way to San Diego after President Obama left the administration, and I wanted to get out of Washington, in all honesty. And I found my way here. And I've been with PCI before it in Global Communities now for eight years. And that is where I met the ebullient master of innovation, Radhika Bhavsar, your beloved professor. Professor Rad, as she is known, inspires me every single day with her curious mind, her willingness to ask tough questions, but always with a smile, to understand the data and the stories behind it, most importantly, to listen and co-create and innovate and prototype and roll out products and processes that deliver social good. Working with people you care about and that inspire you is really important. Rad does that for me, and I know she does that for you. So let's give her a hand. My organization, Global Communities, like many NGOs, is at a tipping point right now. USAID, do you know USAID? Yeah, USAID has been demolished, and most of our US government programs, both here and abroad, have been terminated. There are no words for the grief we are all experiencing as we witness the devastating closure of programs that were saving lives, advancing equity, and securing strong futures. There are no words for the pain of witnessing HIV patients whose access to life-saving ARVs has been severed without notice, of refugees stranded in camps without sufficient water or food, of hundreds of thousands of jobs ended around the world with virtually no notice. Each day brings new developments, often without notice, forcing many of us to adapt in real time. Yet in the midst of so many unknowns, we know that the need for our work has not disappeared. It has only grown. There is still opportunity, I know that, if we choose to find it. It's going to be hard, but we must choose to find it. We are living in a defining moment, a moment that calls for both clear-eyed realism and bold imagination. The landscape you're entering is not the same one that your mentor stepped into even a few years ago. We are witnessing the resurgence of infectious diseases that we once had under control, growing mental health needs in every corner of our globe, and the devastating toll of climate change on food systems, displacement, and disease patterns, even though we're not allowed to talk about it. At the same time, we're grappling with shrinking civil space, democracy under siege, declining trust in institutions, and political shifts that threaten to roll back decades of progress in health equity and human rights. These challenges are not isolated. They are layered, systemic, and increasingly global in their implications. But here's what else is true. We have never had as many tools, more data, or more interconnected talent than we do right now. And we have you. You have the extraordinary opportunity to apply your leadership and what you've learned here to the world's most complex and difficult challenges. What could be more meaningful than that? You know, through your time here, that the future of global health doesn't lie in top-down solutions, but rather in community-based, people-centered, interdisciplinary solutions that transcend national borders or regional interests. Because the truth is this: health is not created by hospitals. It is shaped by what people eat, how they live, where they work, whether they feel safe or heard, whether their voices are heard, or whether they feel a sense of belonging. Communities know better than anyone what is harming their health and what can help. Our job is not to speak for them, but to stand beside them, supporting their vision and helping remove the barriers in their way. You have learned that community-led approaches aren't just more ethical, they're more effective. They foster trust, build local capacity, and lead to interventions that are culturally grounded and sustainable over the long run. I saw that out there. I saw evidence of that out there. And most importantly, community-led solutions shift power to where it belongs, to those who live with the consequences of policies and programs. Global health, at its best, is not a service we deliver, it is a partnership we cultivate. You are not just inheriting the field of global health as leaders, you are shaping its future. And all of you are leaders in one way or another. So what does that mean for you? It means resisting the impulse to default to old models that center outside expertise over community voice. It means leading with humility, listening deeply, experimenting boldly, and learning constantly. It means valuing relationships as much as results and asking not only what works, but also who decided what works and whose voice is not being heard. This field is no longer about just delivering care or preventing disease. It is about dismantling barriers that prevent people from living healthy and equitable lives in the first place. It is about power and justice and proximity. The most powerful proof of that truth is found in all of you and your fellow students right here at UCSD. People like your fellow student, Segen Zare, whose journey into global health is not just academic, but is profoundly personal as well. For Segen, finding the global health program at UCSD was about more than just claiming a major. It was about finding a sense of place that had been missing for most of her life. As a first-generation Eritrean American, Segen shared with me about how her early childhood was marked by experiences of loss, separation, and displacement. A brutal conflict in Ethiopia forced her family to seek asylum, first in Kenya and then finally in the United States. Raised by a single mother with 4 other siblings, Segen said she learned early on about the value of community support when navigating a new life and a new culture. This experience, coupled with stories about her grandfather's work as a doctor in Eritrea, came to shape a space inside her that longed for a similar purpose. Like her grandfather, Sagan said she wanted to learn how to provide care for under-resourced communities from diverse and challenging backgrounds. She just didn't know what to call it. As the first in her family to attend a four-year university, Sagan often wrestled with imposter syndrome, something we all wrestle with, in all honesty, Sagan, questioning whether she really belonged. The UCSD Global Health Program helped fill in that blank, in her words. She said, being here, I felt capable for the first time, like I fully belonged. My lived experience mattered. Her time in the program has largely focused on researching the impact of war and conflict on displaced youth and unaccompanied refugee minors. Having navigated the challenges of assimilation and acculturation as a young person herself, her lived experience gives her the tools, perspectives, and credibility she needs to serve youth in similar situations. She credits what she has learned here with giving her the confidence to be at the table and to feel comfortable with using her own story as a means of building connections with those who feel othered. Sagan has discovered her innermost compass and is determined to lead with it. Her early experiences of loss and displacement, which seemed like unsurmountable obstacles at first, have now become the driving force behind her passion for global health. That inspires me. Stories like Sagan's remind us that lived experience is not just relevant to global health, it is a vital part of what it means to be human. That we have the opportunity to use our own life stories, not as something to overcome, but as a source of strength, empathy, and connection. In every story you've heard today, mine, Losa's, Simran's, Sagan's, there's a common thread, a turning point where our lived experience became our purpose, a moment when we decided not just to care, but to act. We all have a story. We all have lived experience, and each of you will have your own defining moments. Maybe some of you have already had those moments, but watch out for them because they continue on throughout life. Be vigilant, for they will shape your lives in ways you can barely imagine now. So I'm going to wrap this up with a few words of advice that I hope will be useful. Number one, don't wait to be the kind of leader you want to be. You are already a leader in so many ways. So be curious, stay uncomfortable, and let your values lead you. Number two, follow the data and the evidence, but also follow the voices of those whose lived experience are too often excluded from the conversation and the research. Number three, remember that credibility is not built by letters after your name, but by the trust you earn and the impact you make. Number four, if something is not working, pivot. It's not a failure. It's learning. It's agility. It's flexibility. The most respected global health professionals I know are not the ones who got it right the first time. They are the ones who knew when to change course, consult others, and try again a different way. Whether you're in the field, at a desk, or in a policy meeting, remember, your flexibility is not a weakness, it is your powerhouse. It is your superpower. In moments of global crisis, when conflict is escalating and democratic institutions are under strain, the role of global leaders has never been more important. Whether you are a student just beginning the journey or a seasoned practitioner in the field or an academic pushing the boundaries of knowledge, your work is part of something much larger than any single program or any institution. Wherever you work, whatever you do, wherever you are, you have a role to play in making the world a better place. So go forth, bringing humanity into policy, ensuring the data is matched with dignity, and fighting for solutions that don't just work on paper, but in real people's lives. Because the world we want, it's possible. And the leaders who will build it, I see them right here now in front of me. Thank you.
We'll take questions, right?
Oh, yeah.
Yes, Indeed. This was an amazing, insightful presentation. We have, I guess we should use these microphones for, in case people have questions that they want. Can we circulate these around? You have microphones out there, okay. So we can use this. Listen, before people start, I just want to say that all of us are aware of the challenges posed by the current political situation. And we think about it, we know about it, we talk to one another about it, we exchange looks about it. And I think it's incredibly important that it be said right out loud, like Carrie just did. And it can't be said enough, and I'm personally very grateful for you for saying that. I'm also very grateful for Carrie's pointing out that it's not just delivering service that global health is about, but it's partnering with communities. And I'm also very impressed, grateful to observe that we have someone here who has, in their own personal work, a kind of live circuit between the level of walking on the ground in the mode of personal care and accompaniment, and being able to operate at the same time on the levels of global health policy in large organizations and global organizations. And if I may, I'd like to ask a question. How does that circuit between accompaniment and global policy inform your everyday work? And does that experience of your lived experience, does it pose a challenge when you're dealing with people who know health policy but don't have the experience on the ground?
Great question. Let me say one thing about the first thing you said. I want to say that my opinions are my own opinions. I am very aware that there's a lot of pressure on universities, and I don't in any way want to endanger UCSD. So those were my opinions, okay? Just to be clear. I am essentially a field person. I've spent more than 15 years overseas working on the ground with communities. A lot of my work has been with traditional birth attendants. And I love that work. It is the work that gives me joy every moment. I spend a lot of time right now on the computer and in meetings, which is not the same. And I find that I have to recharge my battery often in order to stay just excited and focused. I draw a lot of energy from my colleagues. That's why I talked about Professor Rad. Ironically, my husband's name is Steve Radelet. My last name is Radelet, and his student, he's a professor at Georgetown, and they call him Professor Rad too. So it's kind of funny. So I get a lot of energy from my colleagues. I got a lot of energy from, listening to all of you. I am a person, I think I'm a bona fide extrovert. I draw energy from other people. So as long as I'm around passionate, informed people who care about doing good in the world and who are willing to share their excitement and their ideas with me, then I gain energy from that. So that's one of the most important ways I do it. I also try very hard to, whenever I am at a conversation that's right here, to bring it down to the implementation, the field, and the community perspective. I'm not always successful at doing that, but I really do try hard. And I would say that my organization, Global Communities, is really dedicated to that principle. The communities are our first priority, and so we root all of our work on serving the community first. And so that's why I chose Global Communities and PCI before it. Oh, thank you. I think that was started by my colleagues at Global Communities. Anyone have a question? I love questions, by the way. Yes, thank you. It's always the hardest to be the first question. Thank you. What's your name, by the way? My name's Dan. Dan. Thank you, Dan.
Dan, a microphone is coming for you.
Hello? Okay.
Hi.
As a Jewish and Arab person, my greatest concern in the world right now is what's happening in Palestine. as was mentioned, you have field experience in that region. It seems to me, obviously, not just in Palestine, but in this country, there's often a hang-up on the interest of politics. How can we circumvent the interests of I guess, how does change become generated that doesn't get hung up, that focuses on the people, the communities, without, becoming stuck to the service of a government or a business?
Yeah, excellent question, Dan, and I'll tell you, the issue you raised is the most intractable issue in our world right now, I think, and it also, I think, is a cause of so many other problems we're experiencing globally. I was actually in Palestine, the occupied Palestinian territories, just 10 days ago. I just returned, actually, from the Middle East. And we have a team on the ground there. We have 250 people there, actually, 90 of whom are in Gaza. And our team is working very hard. I mean, they are unbelievably dedicated to working to help their people. I will also say that our team has, for many years, 3 decades, really been leaders in terms of trying to build relationships with Israel. So our team is not a radical team. It is a team that is built around the concept that peace is possible. And so they are trying very hard to remain as positive and as open to ideas as they possibly can be. And I do think that the efforts of good people who are willing to listen is the key. But a lot of times we know that our political leaders are so stuck in their own political position, their own personal position, in all honesty. So much of it is personal position and the maintenance of power and money that they can't, or at least they're unwilling to move beyond, I think. And I know that sounds probably a little bit cynical, but I do actually think that there are some very entrenched interests that make it very difficult to achieve peace in that region. I'll tell you one story, though, that just speaks to both the level of commitment of the people of Gaza themselves and the just despair that is experienced by that community on a daily basis. So like I said, we had 90 people there in Gaza. We are the largest distributor of humanitarian food and water of the World Food Program, which right now is the only organization that is fully operational. All the other groups like World Central Kitchen and Save the Children and ANERA, everybody receives money or food that is brought in by the World Food Program, and then it's distributed out. So we're the largest partner because we have a lot of people who are based in Gaza who are refugees themselves and who get up every single day and go and distribute food and water. So I spoke to Rana, who's our humanitarian coordinator in Gaza, and she just was telling me about her days where she gets up and she says goodbye to her family, and she goes out and spends the day. She has to walk or ride a bike or somehow find her way to the nearest distribution center, which is constantly changing, by the way. And she's in the hot sun all day long trying to help people meet their very, very, very basic needs. Right now, there is no food in Gaza. No food. It's a devastating situation, and people are dying already. Anyway, this is what Rana said that just broke my heart, but also spoke to her level of commitment. She said to me, I get up every single day, and I hate to leave my children, but I know that I have to, or my countrymen and women will suffer. And so when I say goodbye to my children, I hug them like I will never see them again. Because in all honesty, I don't know if I will. I don't know if I will come back, and I don't know what I'll find when I come back. My son holds on to my hand so tightly every night, and he says it's because if we end up in heaven, he wants to be able to find me. That is the personal story of an ordinary person living in Gaza right now. Stories are important. I'll tell you one thing in terms of how to change life. I think this one is so big, it's why, it's hard to know. I don't have any good answers for you, in all honesty, Dan. But I'll tell you one thing, that when I was a Peace Corps director, I had to go up on the Hill to Congress quite often, mostly to advocate for our budget. And there was a senator named Johnny Isaacson who was very wise. He was a Republican from Jordan. He and I actually probably had very little in common in terms of our policy perspective, but he was a fierce advocate for foreign assistance, and he was especially passionate about Africa. And he was a lone ranger in advocating in the Republican Party for strong programming, foreign assistance programming. He sadly died a couple years ago. But this is what he said that I'll never forget, and it's a good life lesson. He says, if you give me a story, you win if you give me the data, you win my mind. You give me a story, you win my heart. You give me both, you win my money. So we have to be a lot better at telling the stories, but also providing the evidence, the data to back it up. That's the best I can say right now. Other questions? Yes.
Thank you so much for sharing all the stories and perspectives. I was curious, I've been talking to colleagues and students about this, as we saw this massive sudden dismantling of USAID, and we come from a subfield where we spend a lot of time criticizing USAID, and yet we're also sort of shocked and that wasn't where the critique was headed, not just to chuck the whole thing out the window, but to reconstruct it thoughtfully. So I'm curious, based on your experience in DC as well as in the field and as a recipient, but also, from the sort of policy side, if you were the one who got to rebuild it, right? We've changed administrations and you get to be the one who's bringing it back online. What pieces would you keep? What would you change? How would you reimagine that, given the opportunity to build it back?
That is an excellent question, and one I'm sure I will not adequately answer, but I share your perspective. I was definitely a critic of USAID, and yet, there was still also so much good about it, and there were so many people who dedicated their lives, not only within USAID, but especially in the whole industry, and it was an industry around it. There was a lot that needed to change, but it didn't need to be torn down. We needed to do a thoughtful analysis and really engage all stakeholders before you just tear it all down. So if I was going to rebuild it, I think what I would try very hard to do is bring all the stakeholders together. Representatives of the stakeholders, including and especially community members and local partners, because what is certain is that there needs to be a much more purposive effort to fund and give decision-making authority. Really to incur authority and funding to those organizations that are closest to where the consequence of decisions is, and so those are the local partners. I would hire Rad and Chris, my innovation team, to do a design sprint, bringing together all of the stakeholders, really key stakeholders, and go through an incredibly thoughtful process and ask people to bring their best ideas. And it would be messy, and it would take a long time. I would want to include people who were huge critics of it. I would want to include Republican members of Congress. I would want to include, those who can't see any connection with it in our country. I think we need to bring people together. One of the problems was I don't think really the United States has any understanding of the importance of foreign assistance to our place in the world and what that means for us as Americans. We have lost so much. Not only have we lost trust and credibility, but we have lost our standing in the world. We have lost our influence in the world. We are no longer a credible partner. That is a huge price to pay, and it was done without thought. So I would want to restore at least a conversation that allowed people to have a voice. Maybe because we did such a bad idea, those voices weren't being heard. We need to bring them into the conversation as well. That's where I would start. But if I was going to put my money on anything, I would focus on climate change. I would focus on global health. I would focus on gender. And I would really, really work with the countries where the work is going to take place to be in leadership, to actively decide, define, direct where that money and effort will go and what kind of programs they need the most. That's what kind of programs they need the most. That would be a place where I'd start. It would take a long time. It will take a long time. And we will rebuild, by the way. The need is not going away. It's just getting worse. So we're going to have to rebuild. It's going to look different, and it will probably be better, in all honesty. But it was a terrible price to pay. And so many people have lost their job, and their lives are devastated, including my own staff. We had to lay off about 75% of our workforce. Literally thousands of people. It was heartbreaking. And the hardest hit actually are the local partners, because many times they're sub-awardees or subcontractors, and they don't get paid until the prime is paid. And this administration has been incredibly slow at paying. So they're folding all over the place, all over the world. So.
Thank you for that. That was a really great answer. Having worked with USAID in Africa and the Middle East, I am a big critic, but also see the need to rebuild in exactly the way that you just laid out, through good governance and community and bringing in all stakeholders. I did a lot of research on USAID in Egypt, and I think one of the ways that we could do this is by bringing in more academics.
Mm-hmm.
The woman that was brought in was an academic in Egypt to run the Good Governance and Democracy program, which was the largest funded program in all of USAID.
Yeah.
And she came straight out and said, we're not even following the principles of good governance within USAID. How can we expect the government of Egypt to do this? So I teach policy, global health policy here, and I keep, my students and I talk about how policy is really about political will and how resources are divided. So I'm going to ask a very provocative question. I hope it doesn't fluster anybody, but having worked in Africa, in the Middle East a lot, in global health, the Peace Corps and USAID are not trusted by local people. They often see, and I've seen this so many times by the local people, they often feel that the Peace Corps is an avenue for CIA and FBI agents to enter into their realm and find out more about them. So I'd like you to address that. That's how locals feel often.
Mm-hmm.
There's very little trust with USAID by locals throughout Africa and the Middle East. The one thing that they do trust is in infrastructure projects, because they get something hard, something's there. They get a sewage system, rather than these consultants that come and go and often don't really understand the political and global health environment very well. So if you could touch on those political issues and how USAID and Peace Corps, American organizations, can try to change the way they are perceived, and how much truth is there in those kind of perceptions.
Thank you. Excellent question. Definitely not a question I haven't heard before. Can't deny, those things are expressed by some people. There are others who express different perspectives, but absolutely, there are concerns about USAID and the Peace Corps for sure. And so part of it is doing a better job of really communicating what is it all about. One thing about Peace Corps, and also about USAID, by the way, both of them operate with the expressed agreement with the host government. Now, you might also say a lot of citizens don't trust their own government, and that's also a fact. And their governments may not be acting on their best, interest. But both Peace Corps and USAID come in at the invitation, and it takes a written action by the president of a country in order to get either USAID or Peace Corps into your country. And then they operate within programs that are specifically agreed upon through project agreements that are agreed upon by whatever the ministry is. If it's a health program, it's the Minister of Health. And in the case of Peace Corps, it goes all the way down to the local community. Like the mayor has to sign off on it. Peace Corps volunteers are placed in communities where the local leaders have expressed an interest in having a volunteer. The school where I taught in Samoa, I was assigned to that school because the principal asked us to be there, and they wanted us to teach the subjects that we taught. So that's the way that the U.S. government seeks to get, buy-in from communities. Now, I would also say that it's not often well understood. For example, many people don't know that if you ever served in Peace Corps, you can never, ever, ever work in intelligence. So if you cannot, it's an impossibility for a Peace Corps volunteer to work for the CIA. It's not allowed because that would compromise the security of a volunteer. So I think a lot of it just has to be accomplished through people-to-people diplomacy. The best advocate for Peace Corps is the individual communities where volunteers work, the people who know them best and who work alongside them. And I would say that's true about USAID too. I'm not saying that it's always perfect. It is often not perfect. But the personal relationships of trust are key to the success of every program, including Peace Corps and USAID. So, the degree of success is because of the relationships of trust that are built, because of the co-creation and the collaborative working together. And where that fails is where the programs also fail, I would say. We have a lot to learn. I believe that USAID will come back in a very different way. Peace Corps is also thinking about how it needs to change and evolve. And I'd love, if you have ideas about how to do that, I would really love to hear them. It's an excellent question. We need to ask ourselves these questions, so I really thank you for your question.
Yes. Firstly, thank you very much for all the passion and the work you've been doing and continue to do to make this world a very healthy and better place for all of us. I come as an immigrant from India and I've settled here. My daughter chose the Global Health Program at UCSD and not very knowledgeable in that field. I somehow lack the direction that I can provide to her. And with the current happenings, like you mentioned, with defunding of USAID and all the other things that are happening now, I see these undergrads struggling a little bit in terms of the way forward. I would hate for them to go outside of their passion.
Yes.
So if you could help them in some way, or the department, or even now, with resources that they can be pointed towards so that they can continue in the same field if they would like, that would be really nice, something nice to hear about.
That, I saw a lot of heads shaking. That was an excellent question. I think you spoke the question that was on everybody's mind.
Sure.
It is challenging right now because the jobs are not there like they were. But there are still jobs in global health. There are jobs in this country that are working with diverse populations that mirror international populations. You can have a global health experience right here in San Diego or in this country very easily, and the skills in global health that you develop are so applicable here as well. What people are talking about now is like consider the private sector or consider other adjacent careers. And, I suppose there's definitely something to say about that. I guess the thing that I think about, what would I do myself? I think that I would still want to fulfill my passion in whatever way I could. So if I couldn't find a paying job in global health, I would probably get a job that would pay the bills, and then I would volunteer because the needs have not gone away. They are only increasing. and there is going to be more and more need for excellent volunteer support. And I was so enthused by the number of your panel, or of your poster sessions that dealt with volunteer opportunities. I believe in paying volunteers, just so you know. We pay all of our interns and our volunteers because it's also a privilege to be able to work as a volunteer, so let's just acknowledge that. But I think that there are opportunities in other adjacent sectors where you can fuel your skills and passion. I actually believe that within a couple years, we're going to see the resumption of programs because people are going to begin to protest. I mean, there is going to be a resistance. And I think some of these programs will come back, hopefully in a better form, hopefully in a way that's more, culturally appropriate, more supportive of indigenous knowledge and experience and leadership. So I guess that's what I have to offer. It's not a perfect solution. I know it's really hard. My own daughter graduated from university in 2008, right after the huge economic crisis, and there were no jobs for a while. She found a job. It took longer. It took a little bit longer, but she found a job. You will find jobs. And if you don't find the job, your dream job right away, find a job that pays the bills, but try to find a way that fuels, to do something that fuels your passion. Because you don't want that to die. You can't let that die. The jobs will come back. I don't know if that's an adequate response. Anyway, I don't have any magic bullets for you. Okay.
Thank you again, Carrie. You can tell we're wrapping up here. And I would like to thank you all in the audience for joining us today. Special thanks to our speaker. Special thanks again to our sponsors, our students, and everyone here in attendance. Today's event not only highlights the research that we share in common and the passion that we share in common for helping people improve their health, but also celebrates the end of the academic year and the success of our graduates. Please join us for cupcakes, celebratory cupcakes, to recognize this milestone. Congratulations to all of our graduating students. We couldn't be more proud, and we know your future is bright. Please take note of the extra credit form displayed on the screen and the QR code for receiving extra credit for those of you who are in extra credit granting global health classes. And let's just have one more round of applause for celebration's sake.